Immun'Âge FPP protection against common upper respiratory tract infections. Hello, I'm Dr. Pierre Montello, Director of the Osato Research Institute, and I'm going to present you with Mrs. Amelie Montello, a study on the protective effect of Immun'Âge FPP in acute respiratory illnesses, study conducted by Professor Francesco Murata.
Hello, I'm Amelie Montello, Scientific Researcher and Communication Manager of Osato Research Institute. Immun'Âge FPP from Osato Laboratories in Japan is an exclusive process of fermented papaya. The airways are divided into two main parts. The upper airways, consisting of the nose, nasal cavity, larynx, and pharynx. The lower airways, consisting of the trachea, bronchi, and lungs. Most common respiratory tract infections are colds, flu, and sore throat. Colds are usually caused by viruses such as adenovirus, coronavirus, and rhinovirus. Influenza is mainly due to the influenza A virus. In children, enterovirus and RSV, respiratory syncytial virus, cause respiratory infections such as bronchitis. HMPV, human metapneumovirus, causes colds or pneumonia.
Since normal breathing is through the nose, most airborne particles are filtered out through the nose, so the nasal mucus is the first line of defense against airborne particles. The upper and lower airways protect the lung through anatomical barriers. They are associated with the cough reflex and use the mucociliary system. Everyone is born with innate, or natural, immunity, a type of general nonspecific protection represented by lysozyme, antimicrobial peptides, AMPs, as well as superoxide dismutase SOD and other phase II antioxidant enzyme. There is also a specific line of defense with production of IgA in the mucus. Studies clearly show that protection against respiratory tract infections is mainly due to local immunity, in particular immunoglobulin A, IgA, present in mucosal secretions. Microbes that penetrate the mucosal layer are subject to a second line of defense that includes antimicrobial peptides and lysozyme, which kill many strains of bacteria or viruses. The main antioxidative enzyme in the respiratory tract is the SOD, which protects against oxidative stress and inflammation.
Osato Research Institute and Professor Francesco Murata and co-authors conducted a study to show how Immun'Âge FPP could help the body protect itself against acute respiratory illnesses. Study published in 2012 in the Journal of Biological Regulators and Homeostatic Agents. Study Summary. We recruit 90 sedentary healthy patients divided in 3 groups of age. We give them during 6 weeks FPP or placebo with washout period and in a crossover manner. Measurement of saliva flow rate, secretory IgA and lysozyme production as well as gene expression of SOD and others enzymes phase II was performed in order to see action of FPP.
Epigenomic modification gene expression by Immun'Âge FPP. You can see here that the main protective enzyme in lungs, superoxide dismutase SOD and all other antioxidant enzymes have with Immun'Âge FPP a significant increase in gene expression in all subjects, regardless of age group, A, B or C. This means that Immun'Âge FPP is able to counteract the onset of oxidative stress in the respiratory tract, which could help protect against severe cases of respiratory infections. Salivary IgA secretion, effect of Immun'Âge FPP after 6 weeks. Can be seen that IgA production is significantly increased by Immun'Âge FPP in all groups. Salivary production in elderly subjects was significantly lower at the beginning of the study. Effect of Immun'Âge FPP on salivary lysozyme secretion. Salivary lysozyme production was also significantly increased by Immun'Âge FPP in all age groups, which could contribute to the destruction of microbial walls. Conclusion on Immun'Âge FPP supplementation. Immun'Âge FPP supplementation for 6 weeks resulted in higher concentration of salivary immunoglobulin A and lysozyme. Immun'Âge FPP induces a significant increase in phase II enzyme and in superoxide dismutase (SOD) expression in the human airways. With these significant effects, Immun'Âge FPP helps to reduce the respiratory oxidative stress in the human airways and increase protection by lysozyme and immunoglobulin A. This will decrease incidence as well as severity of respiratory tract infections.
Immun'Âge FPP protection against common upper respiratory tract infections. Protection during winter. Dosage: 1 to 3 packets per day during winter time. Action: reinforces local mucosal immune defense of upper respiratory tract. Result: contributes to decrease risk of common upper respiratory tract infections. Boost at first symptoms. Dosage: 3 packets per day for 2 to 3 days. Action: boosts local immune defense and decreases linked oxidative stress. Result: helps decrease severity and duration of infection. Thank you for your attention.